Meeting is called to order.
Thank you, President, sir. I welcome all our esteemed members to join the meeting in another edition of our club. And now I request President, sir, to confirm the minutes of the previous meeting.
The minutes of the previous meeting were circulated, and as we have not received any objection or observation, I presume that everyone has confirmed. So I hereby confirm the minutes of the previous meeting.
Thank you, sir. It is very heartening to tell. Today we have a very esteemed guest with us who will give us a talk on the government role in organ donation. He is none other than Dr. Sanjay Dikshit, ex-in charge, Soto MP and founder secretary of the Indore Society of Organ Donation, Indore. I request Rotarian Ruby Agarwalji to give his introduction. Ma'am, please.
Thank you, Rotarian Pratul, and thank you, President. I take the pleasure in introducing our guest of today, guest speaker, Dr. Sanjay Dikshit. He's a MD, PhD, a senior medical professional and organ donation advocate. His professional experience is he's a former dean, MGM Medical College Indore, former dean, Government Medical College Ratlam, founding secretary, Indore Society of Organ Donation, former in charge, State Organ and Tissue Transplant Organization, Soto, Madhya Pradesh. His academic contributions are 37 years teaching experience in community medicine, mentor to undergraduate and postgraduate medical students, extensive research background in public health initiatives. His achievements in organ donation: he led MP Soto to receive Best Soto Award from National Organ and Tissue Transplant Organization, NOTO. Instrumental in Madhya Pradesh being recognized as Best Emerging State in Organ Donation by NOTO. He is a dedicated advocate in the field of organ donation for over a decade. His specialization is in community medicine, public health policy, medical education administration, organ donation systems development. Thank you, Dr. Dikshit, for being with us today. And over to you, Dr. Dikshit.
Before Dr. Dikshit will join, I would just like to say a few words. We met Dr. Dikshit through Dr. Verma, who is our Rotarian, Dr. S.K. Verma, who is our esteemed member, as well as our charter treasurer, Rotarian Ramnath Pradeep, in his office in Indore, MGM Medical College. And we found him down to earth and always ready to do something for organ donation. A dedicated person, and whomsoever we spoke in Madhya Pradesh and Indore and Ujjain when we were in that particular trip along with Rotarian Ramnath Pradeep and Rotarian Dr. S.K. Verma, everybody spoke very high about him. So welcome Dr. Sanjay Dikshit to meeting. And when I gave a call to him, he immediately says, yes, why not? I am ready to give my opinion and my views. So welcome, and now over to you, Dr. Sanjay Dikshit.
Thanks for a nice introduction. So we will be first discussing for 10 to 15 minutes on my presentation, followed by discussion. So can we start sharing?
Yes, please.
Can we have full screen? Can we have a slideshow?
We'll just, full screen.
Shall we start?
One moment. I will just
go to slideshow.
No, it has gone. Now we are trying just.
Sir, fine.
Inch out for a bigger view.
Same place, same place.
Yes, please, go ahead.
Okay, so we will be discussing the role of government in organ donation. So to start with, the first question is organ transplant legal? So the answer is yes, provided that we go with different transplant organ act, different transplant rules, then THO amendment rules and act, and the latest THO rules 2014. So it is very important that we all legal aspect, and one of the important aspect of government intervention is to see that all legality is maintained. As you know, the legal framework for organ donation and transplantation is a Government Regulation Act 1994. The basic purpose is the role of government is to organize an efficient mechanism for organ and tissue procurement, retrieval, especially from deceased donors, and their distribution for the transplantation. Then to monitor organ and tissue transplant services, including the legal framework, and to bring about policies and program corrections, changes whenever needed. So as you know, over a period of time, lot of changes are being made and being regulated. We have this national, regional, and state network and national registry for organ and tissue removals and storage, allocation, and transplantation. That is, just as you know, we have to have a NATO ID for all the diseased person and those who are getting the organ. So this is just to have a legal framework, so legality and the right person get the organs. Then the fourth issue is the capacity of personnels involved in organ and tissue donation and transplantation. So the training of the transplant coordinators, training of different specialty is also done with this NATO organization. Then advocacy for promoting organ and tissue donation and carrying out various IC activities for increasing awareness among the general public and stakeholders. Then we have this one nation and one policy that is recently implemented, in which there is no domicile requirement, no age bar for registration, and waiving of the registration fees by the transplant hospitals. So these are some of the issues which are taken in the one nation and one policy. Then seventh is the develop requisite infrastructure for organ and tissue donations and transplantation activities at various levels, an effective transport system for rapid and safe transportation of organs, tissues within and across the cities, whether it is by surface, metro, by air, train, or any other issues. So as you know, we have to prepare green corridors. We have to find out, we have to honor the timelines. Say heart for 4 to 5 hours, liver for 10 to 12 hours, kidney for 24 hours. So for that, we create green corridors, we create surface corridors, we create recently there is a green corridor prepared in a metro also. Then providing a support system for living donors in form of insurance. And in Madhya Pradesh, we have just declared that all the BSD patients' relative will get an Ayushman card so that they can get 5 lakhs insurance per year. So this is an added advantage. Then immunosuppressant drugs to the BPL patients, so that so that there are chances of getting more survival rate. Then dignified funerals, then enforcements of mandatory declaration of brainstem death is required, and this is also made mandatory. By dignified funeral, we mean that the government is providing rupees 10,000 for funeral expenses, and in some states they have started giving state honor and police recognition of their sacrifice. In Madhya Pradesh also this is in pipeline. Next, please. So this is the networking of governance of organ donation. We have NATO. NATO has different ROTOs, that is regional transplant or tissue organizations. This ROTO have some SOTOs, which is the states which is linked with different ROTO. I will next, please. So the role of ROTO is as given here is the policy guidelines and protocols. So they prepare all policy guidelines and protocols. Then we have all SOPs and technical guidelines for kidney, liver, pancreas, heart, skin, hand. For all that, they are SOPs and which can be taken care of. Then we have a web-based networking. That is what I was saying, that the NATO website. So initially, the persons who are going to be in wait list are put online by the hospitals in a NATO registry, where this is uploaded, and from there it is go to ROTO and ROTO to NATO, starting from the SOTO. Then coordination when organ is allocated outside the region and PIU and to the foreigner. Say if in Madhya Pradesh there is no recipient for heart or lung, then a call is given to ROTO, and if it is not in a ROTO region, then a call is given to the NATO, where they decide be. Then they are doing different research as activities. Then they have the website for dissemination of information. Then they coordinate, organize training for particularly transplant coordinators, 5 days training, consultancy support on all aspects of donation and transplantation, then national biometric centers and SOTO for Delhi. Then, as I said, the NATO is the premier. Then this is followed by ROTO. ROTO is at regional levels. They coordinate with the SOTO. SOTO is functional at the state level. Then whenever a organ is to be given to the state other than with outside the state, then ROTO coordinate for that. And it also collect the data and statistics for registry of the regions. Then they do the monitoring and surveillance, training of workshops, then developing IEC and as per regional need in the regional languages. Then they undertake intersectoral meetings, IEC advocacy for disease organ donations in the regions. Then they also provide the technical guidance and support, and establishing and operationalizing regional biometric centers. Then the basic unit is the SOTO. SOTO's role is very important as it is the implementing authority in the state. It also coordinates with the state government for the different regulation. I will just share that in one of the case, there was a girl who want to give liver to her father. Her age was 17 years, 11 months and 15 days. So as per definition, she was minor. But when we have consulted the different doctors, created a board, then was given a go for that life transplantation. So this is how the SOTO works, and it maintains a state-wise wait list of the patients, networking and a state level registry, coordinate from organs and tissue procurement, matching, allocation, transportation, storage, and transplantation. I think at this point, I want to share that during this for coordination of organs, tissue procurement, matching, allocation, we have to work like a war center, because there are so many things, so many decisions has to be taken. What is the allocation scores? What is the matching? And how, say, in heart is weight is matching or not? Then blood group is matched or not? Then how to plan for the transport of the organs? So lot of things has to be done at the SOTO level for the organ distribution. Then it coordinates for the BSD certification and retrieval teams. So the movement of retrieval teams is also, so the basic unit who works for allocation is the SOTO. And of course, dissemination of information to the hospitals and organizational and of the individual activities. So this is how the government regulates the organ donation in our country. Next, please. So we have different type of authorities which actually governs the implementation of organ donation. One is appropriate authority. This appropriate authority is, say, in Madhya Pradesh, we have the medical colleges, and all medical colleges deem are the appropriate authority who decides about the organ donation. Say, registration of transplant, non-transplant human organ retrieval centers. So any hospital who want to start the transplant activities or non-transplant retrieval centers have to apply to the appropriate authority, who constitute a committee, and that committee decides, they make an inspection and decide whether to give or not. Then for registration, above center need to apply to the appropriate authorities in a prescribed format of THOA 2014. After inspection of infrastructure, human resources and other equipment, appropriate authority will issue registration certificates. This registration is for 5 years, and then we go for the renewal. Other than appropriate authorities, we have the state authorization committee and authorization committee at hospital level. So if a hospital has having more than 25 organ transplant in a year, they can constitute a authorization committee which decides for the NOTO registration and how the allocation scores is taken, whether the relatives are there or not, and to find out the relations between the donor and recipient. And if it is less than 15, then the dean authorization committee, which is at district level or division level, it decides. So this is just to mention that the government role is everywhere in the organ donation activities. And in some cases, as I said, that we had some bad incidents in recently at Rajasthan. So for that, the appropriate authority has the power to act and to make a complaint to the police and other people. Next, please. These are the law which governs and depicting the offenses and penalties. So if render services to the hospital who remove organ for transplant without authority, say without registration, if they are going transplant activities, then there is a penalty for 10 years imprisonment and 20 lakhs fine. Makes or receives payment for the supply or for an offer to supply any human organ, then penalty is up to 20 lakhs to 1 crore, and imprisonment is 5 to 10 years. Seeks to find persons willing to supply for payment any human organ and initiate or negotiate such arrangements. So all these activities which is illegal are punishable as per the act. Next, please. Then if someone publishes or distribute or causes to be published or distributed any advertisement inviting, offering to supply organ for payment, advertisers willing for such arrangements. So all this is also punishable with 5 to 10 years of imprisonment and 20 to 1 crore of penalties. So abets in preparation and submission of false documents and abet. Say this is what usually happens in Rajasthan case also. They have prepared the false documents and affidavit, and in most of the cases this is one of the important point which has to be taken care by the authorization committee and appropriate authority, because in most of the time the default is this only. And as I said, that it is again 5 to 10 years of imprisonment and 20 lakhs to 1 crore of penalty. Illegal dealing in human tissues is also punishable. Any other provision of act, rule, conditions of registration, maybe if they have done some fault, then it is also punishable under act. Next, please. Then there are certain issues and challenges which we are facing at our level, and all of us are facing rather. Then in our country nowadays, as life expectancy is increasing, so there are high burden of organ failure cases, particularly for kidney, liver. There is a quite increase in these cases. Then poor availability of donors, that is, as you know, demand versus supply. If say there is a demand of 100 kidney, the supply is only 5 to 10. So there is a wide gap both for kidney, and as we are all aware that now we are getting more cases for liver also. Liver failure cases are also increasing, but there is a wide gap. Then there is a lack of awareness of concept of brainstem death. Then less number of brainstem death certification by hospitals. This is one of the major two reasons for getting less number of organs, because there is no clear-cut mechanism of certification at the hospital level. There is highly under-report. The statistics says that at any ICU at any point of time, there is chances of 5 to 10% suspected brainstem death in the ICUs, but they are not reported. The hospitals are not ready to share the information. They are hesitant because they think that if they report, they have to maintain the organs and they have to do a lot of the work, and they have to keep the patient for 3-4 days and all that. So because of that, this is underreported. Then we have non-availability of adequate infrastructure, especially in the government sector. So say in Madhya Pradesh also, we have only in 2 medical colleges out of 20 where organ transplant, that only of the kidney takes place. There is no facilities at district level, no facilities at divisional level. So we need to increase the availability of the infrastructures. Lack of awareness and attitude to organ donation. As you know, it is very difficult to convince the attendant that the patient is no more because its heart is pumping and beating. So it was very difficult sometimes to get the counseling. Then we have the problem of potential organ training. Then some of the states in South are not implementing THOA Amendment Act 2011. Then there is a problem of transportation of donated organ across the states if it has to go. But luckily, with Prime Minister ambulance services, we are able to do better. Then there are issues in disease organ donors for speech heart to the foreigners. Then lack of organized networking system between ROTO, SOTO, and NOTO, ROTO, and SOTO, and high cost of organ donation. So these are the some of issues and challenges which we have to follow. That last is, this is the pledge. I think all of us has already made this pledge of organ donation. So this is a brief discussion on my part. Thank you.
Thank you very much, Dr. Dikshit, for giving such a nice and very informative presentation. Before I will open the questions for our members to ask, I have few things to ask you. See, you know very well, and we discussed earlier also, the main problem is the infrastructure. You also mentioned about the government hospitals. Now, the thing is, when we are talking about infrastructure, hardly 15% of the revenue districts in India are having the organ transplant or organ retrieval center. 85% districts in India are not having even an organ retrieval center. It means we are just reducing the potential by 85%. Don't you think that the first priority of NOTO, ROTO, SOTO, or the government of India is to create infrastructure in all the district headquarters at least, so that the waste of organs, because nobody will come from one city to the other city for bringing the patient in a brain dead condition, especially when there is not even a brain dead declaration committee
Yes.
in those
Yes.
cities. So these are this is a very big challenge. What action Noto, Soto or Roto are taking in this?
Recently, probably we have discussed with you also. They have provided a one-time grant of 1.5 crores for development and establishment of the transplant centers. So they have opted for the proposals from the states and from the medical colleges. So in Madhya Pradesh also we are going with that, and say in Madhya Pradesh also we have appointed all the deans as an appropriate authority, so that at divisional level it will be easy to constitute the brainstem death certification committee, because empanelment is done by the dean and appropriate authority. So in that direction, NOTO is doing.
No, that's true. But the problem is when there is no such type of committees, especially in a city which is not having any retrieval center. What action? Now you are mentioning about 1.5 crore. We discussed this also. Is it only for the government hospitals,
Yes.
or is it also for the private
No.
hospitals or the medical colleges?
It is for the medical colleges, government hospitals.
Only government medical
Government
colleges.
hospitals. But looking into the present situation, have retrieval and transplant centers even at divisional level. So it will a first step forward to get it percolate to the district level. It is not there.
Yeah.
It is that is not there, right?
Why I'm asking this? Because recently I met the principal of the SN Medical College Agra. Now, SN Medical College Agra, which started in 1939, is one of the very first medical colleges in India, but they don't have this. And when I discussed with him, his reservation was that, see, there are so many problems. I said, but 1.5 crore government is ready to give. And but he says the money is not the problem, because money is already there. And many of the Agra philanthropists told me that we are ready to give money to the medical college, but they should start it. The only thing is the hesitation of the government officers, medical officers, the principals, the dean, etc. How we can, or means we means you, the government, can at least change the mindset of the government medical colleges and the government hospitals, because after the accident, the first thing we have seen is the patient is to be rushed to the government hospital anywhere in the country. So
Yes.
maximum patients are coming to the government hospitals. And if there is no such type of facilities in the government hospital, nobody is interested to declare. I will tell you, we had a meeting in Mangalore, which is having 9 transplant centers, organ transplant center, and 11 retrieval center, but the government hospital was not having the retrieval center. And we had a long discussions, 8 years. It took 8 years. Now, this year only it started at Mangalore, the retrieval center at government hospital. Because the private hospitals were saying, we are ready to retrieve, come and retrieve but because the patients are coming to the government hospital, and from there, nobody is interested to declare the brain death, as you said rightly, that all the ICUs are having. So unless this basic change is not been done, don't you think that it is very, very difficult? The workload will increase, as you said, the war-like condition, it will be always there until
Yes.
it's not divided. What is your opinion about this?
Definitely, we need to have the capacity and sensitization of the policymakers in the states so that they can understand. And I think the other step is that if a well-planned trauma center is developed at the casualty, so at least to start with, we can have the retrieval center. So those retrieval centers can retrieve the organs and can distribute it to the private hospital to start with. This is my suggestion.
Okay. Thank you, Dr. Dixit. Now I will open it for our members to ask the question. So whoever wants to ask, just unmute. Yes, Rotarian Ramnath Pradeep. Yes, please go ahead.
Hello, Dr. Saab.
Hello.
It's a hearty welcome to you. And we are meeting after almost a year back. I came myself and
Okay.
Mr. Goel, we came together and we met you. At that
In
time,
fact,
you had also got a promotion.
yeah, yeah.
So I was very happy to meet you. And
Okay.
this is a issue which Mr. Goel has already raised, but there are some other issues which I would like to, since you are already there in the state, and you will be also taking the matter with the NATO also. How do you feel that NATO, SATO, and ROTO are effective as of today?
Yeah,
In their organization is there, but how they are effective?
they need to be more effective because there are some issues in coordination. But still, presently, there is an increase in activities. Say the way it is make mandatory to have a NATO ID and doing the supervision and monitoring work through ROTO is started increasing, but lot of work has to be done in that part.
Sir,
As
you
I
are
said,
already there. You are in. You are now the at the top of the affairs of the the organization. Is it not necessary that you should take? You are already taking a lot of steps, but little more effective steps can be taken so that and involve the private sector also, so that though there is involvement of the private sector, other organizations are also there, so that they can really contribute and support your efforts.
definitely there is a need for the effective linkages with the NGOs and private
Yeah.
organizations. Definitely.
Thank you,
Sec-
Dr. Ramnath Pradeep.
One minute, 1 minute. I got
You
some
want
more
to?
question
Okay.
to ask.
Okay, yes, please go ahead.
Dr. Saab, I recently addressed some of the senior citizens. Recently, I'm talking about a week back. Now, majority of the people, they say that though we have placed our organs, but we don't know whether my family will give or not, and the consent. Why once the individual has already placed their organs, as like in case of there is a bill are executed, so no question asked, why the family members are being asked again when the place is already undertaken? Why can't the committee take a call that there is already a place and the decision is required to be taken by the committee and the family can be informed?
Okay, fine. So this is basically the policy of the government.
No, that's why, sir, I'm saying that
So we have to put
policy
this
needs to
matter at
be
not to a higher
addressed.
level. Yes, yes, that is, I agree with you. But that has to be decided by the government. But right now, even if they give it the consent of the nearest is taken, right?
Sir,
So
you are
yeah.
now in the position
No,
to guide the
I have
people at the senior
yeah,
level.
I've noted this point. So whenever now we will having say we frequently meet for that one nation, one policies meeting.
Correct.
So we will put up this matter.
One more question, sir. President, one more question. There is a lot of death is taking place on account of the accident. The young accident is taking place, particularly on the roadside accident taking place, particularly the motorcycle and other things, where there is every possibility that person goes in the coma. He is
Okay.
always there, brain dead. Now the question is, and there is also some of the states have implemented that there is a deemed consent in the driving license
Yeah,
itself.
we have in Madhya Pradesh also we did that.
Yeah.
Right. Yeah.
So why can't we use that, the facility which is available, which is legally now permitted? Why can't we use and come with some committee mechanism where such type of things happens? Committee can take a decision and then inform the family members and pursue the family members.
Okay, so this is basically, as I told you, it's a policy matter. So we will put it at appropriate platform. Your suggestion.
So we invite us. We can also
The part
make
of
us a
that
part of
discussion.
your
Discussion.
part of discussion. Yes.
Okay. Okay. Fine.
Okay, thank you very much, Rotarian Ramnath Pradeep. Now, just continuing what Dr. Rotarian Ramnath Pradeep said, he said about the role of NATO, SOTO, and ROTO. See, the problem which we faced, I met the SOTO chief in Dr. Harshvardhan in UP, And there I discussed with him that if suppose some private hospital or the government hospital wants to start the organ retrieval center, who is the appropriate authority? And he says the appropriate authority is the State Medical Education Department. Now, in UP. And then,
Okay, maybe in UP.
so now, if it means the hospital has to apply to the UP government with the not with the SOTO first, they have to apply, take the permissions, because they will do the inspection, everything. And once they will start giving everything, when they will give everything, then only the role of SOTO, NOTO, and ROTO will come. Because
yes.
so there are two agencies working only on the same thing. Don't you think it is a high time that we must merge, or either we we have a SEBI, if we've seen the financial thing. SEBI is having controlling things in all types of instruments whatsoever coming in the market. Why not, when we are talking of organ donation, NOTO is going to have should have the same authority. So that person should not go to the government, state government, and then go to the SOTO. So there will be a duplication of work. So much red tape is, and it takes not even 3 months, 1 year, just for a permission to set up a retrieval center. This is one thing which I'm sure you are going to take up. And secondly, what Rotary and Ramnath Pradeep is saying is basically that we should change from opt-in to opt-out system, which like UK has changed in 2020.
Spain also there.
Europe, almost all the European countries are having opt-out system except USA. But USA is still, they have that much infrastructure that within an hour, any death occurs there, it is reported there. But in India, nobody, because there is no committees, no, 85% of the population doesn't have the retrieval center. So that is, I think, one of the reasons.
Yes.
So anyway.
So I think as we have discussed, to start with, at least we should start opening of the retrieval centers so that the collections of organ can be done and it can be transported to the nearest transplant centers. Say in Indore also, we did it the same way. We have linked different private nursing homes, which are even not a retrieval center, to the center which is having a retrieval and the transplant center. So patients can be referred there, do the retrieval and the transplant. So in one of the discussion with NOTO, I have also put up this proposal. So let us see if they can accept.
Dr. Dixit, I have written a write-up on this. Why not we start? Because see, we can understand that in the different cities, it's difficult to start at this point, and it will take time, 85% cities to be covered, district headquarters. Why not we start a mobile retrieval center? Because there are mobile operation theaters, well-equipped, are available. If we will have a mobile retrieval center, we can keep it in one of the districts, which can go, because now our national highway is very good. From one city to the other city, one can reach in 2 or 3 or 4 hours. Because if this is not a emergency surgery, you also know that it takes some time for the retrieval, and that by the time the patient is ready for the brain death committee has already given, after the mandatory 6 hours gap, the final certificate, the operation theater will be there for retrieving the organs. Once the organs are retrieved, it will be sent to wherever it is required for transplantation, and then the operation theater can go. So it can at least immediately some relief can come. What do you say about this, Dr. Dixit?
I think this point were discussed during Chintan Shivir also. I think you were there in that place, where I have also put this point. So that is put it in their discussion bar. We have to see what the final decision government is taking on that. But this 2 points we have discussed during Chintan Shivir also.
Okay, thank you very much. Yes, who else wants to ask the question? Dr. Moniz? Dr. Moniz? Please,
So good evening, sir. Good evening.
Good evening.
This is Dr. Rohan all the way from Bangalore, sir. So like a President Ji had just put up saying that, okay, we've got about 8 transplant centers and then retrieval centers. So I'm actually trying to convert my medical college center into a transplant center. But what is happening, sir, what the district says, this is a practical issue, just sharing with you, sir. What the district is talking and what the state is talking, there's a mismatch. Like once the transplant team will come, then after that, it seems the brain brain retrieval team will come maybe a couple of days later, for signing off as a brain retrieval center. So I was thinking, just to make these things easy, because every city has got a district hospital or a nodal officer is available. Now, उनका ऊपर से आना जाना वो पड़ता है, and it is not happening. The dates are getting postponed or preponed or something like that. Can the NOTO help facilitate a structure wherein saying, okay, you have a regional urologist. Suppose we're talking about kidney transplants. We have a regional like urologist, and he's got a team who's a neurologist or a neurosurgeon there. They can come in, facilitate, check, do a photo op, make up a pile up a report, and probably compile a report and send it to the state for thing done. Because this is the first time we're also enjoying the facility and trying to understand how these things work. It's a slow and a steady process. And just for the state to enhance the number of transplant units in the state of Karnataka, so they've hired, there is a private person, a private cardiothoracic surgeon called Dr. Ravi Shetty. Sorry. So he's been assigned as a convener to overlook so that there are no hiccups or things happening. So he's trying his level best being like a cardiothoracic surgeon or a cardiac transplant surgeon. But yeah, it's a very slow and a methodical process. So, sir, if possible with the NOTO, whenever you guys meet, sir, if that proposal happens. So what is happening? So because you're talking about US and how President Govt just put up saying that, yes, it's an opt-in system in the US. So I've got two friends in US who have altruistically donated 2 organs and are also running marathons. And they have become like messengers of life or like life saviors, encouraging more people. So they formed a huddle of about 5-6 people who have donated 2 organs. Understand? And it's like a purely like an altruistic kind of a system. Now, India in 2025 is pretty in the medieval times. We're still struggling for infrastructure, people, assessment, paper writing, all this work. वहां पर वो जाके नाम दे रहा है, okay, if there's a match, you give me a call. I would like to donate to any person I do not know. It's a beautiful kind of a system. And this guy is still doing very well. I'm in touch with him. So we want to get there, sir. And like you see the energy level on this group right now, this is the final point, sir. And is there any way that the Rotary Club of Organ Donation International can be an NGO, like an invited member of the NOTO panel? If possible, sir, it would be a huge thing for us because we live in remote parts of different different states of India, sir. Like you see, I'm representing Karnataka. We have Ramnath ji from Maharashtra. Sir knows from UP. We have some people from Delhi, etc. So on the ground messages are different, and we've got nothing to make out of it. We're just being messengers of change and trying to create awareness or improve on advocacy. So if there's something, Dikshit sir, you could, propose to the NOTO saying that, okay, there are organizations, I think we should give them a hear out so that practically can have a more wider exposure rather than going on an assembly line. Just
Okay, we will take care. As I said, it is, but I think we can, to start with the retrieval center, permission should be given very easily because where there is only the facility of OT is required. Although for transplant center, we need to have a rigorous inspection. But for retrieval, we can say in Indore, say about 8-9 years back when we started this organ donation movement and we don't have any surgeons who do the liver transplant or heart transplant. So what we did is that we have MOU with Apollo Hospital, with Medanta Hospital, and the hospital in our place get the retrieval and get transplant through the supervised management with those. So such sort of things we can do, and at least I agree with you that for retrieval center, because for retrieving the organs, we only need a OT type of establishment, right? Yes. And for retrieval surgeons, we have a MOU with some bigger hospital where retrieval surgeons in Indore also, when we start with about 8-9 years back, the retrieval surgeons come from other places to retrieve the organs. So yes, this is a good suggestion. And
fortunately, Dr. Dikshit, in India, all the medical colleges are supposed to have operation theatre, not one more, but minimum one.
But
in spite of that, the permissions to take the permission even for retrieval center is not possible, not easy, and they said though we are not interested to, because the condition until unless we will not break the red tape is, and that's why what Rotary Namnath Pradeep says, I also advocate the same thing. Give the teeth to the NOTO and make it a autonomous body like SEBI, full
Okay.
power, no need of going to the state government. Because see, when you are monitoring everything, you should monitor to give the registration that this particular hostel is registered to get the permission or not. But if we have to go to another department, in my opinion, to be very frank, don't take it otherwise. NOTO is a toothless body in India. Although it has been created, set up by the Ministry of Health and Family Welfare, but they don't have any say, because until unless the government will not have. I will give you one more point, but before that, I want that somebody can ask further questions. So yes, Rotary Pratul Agarwal.
Welcome, sir. Welcome. First of all, I will like to compliment you for managing the organ donation of a just minor. He was just going to turn major. It is a really credible thing. You understood the need and got it done. And my question is on the same line, because you are associated with policy making also. There are so many rules and regulations. Sometimes we feel like whether government is encouraging the organ donation or discouraging the donation. Getting an organ donation or organ transplant has more than a medical procedure, it's a legal procedure. And getting it done is like in a legal case.
No, your voice is okay. Yes, Dr. Dikshit, can you hear?
My submission is, sir, key issue is that the health implementation of health structure is the in purview of the state government. So all the national bodies are national programs. They can give the guidelines, but implementation part is to be done by the state. So we have to put that issue also.
But Dr. Dikshit, in this way, I will say, what about COVID? What about COVID? COVID was also a health issue. It was not a financial issue. First, the health issue. It was the entire power of the central government. This is also a very, very alarming issue. People are not understanding, but you know very well. Recently, there was a report from the Karnataka, Bangalore, that 20% of the IT professionals are now suffering with the organ problems, organ failures. Now, if this is the situation, what is going to happen? And this 5 lakhs figure which NOTO is giving, they are not updating their side. They always say 5 lakhs, 5 lakhs. How is it possible? We want an exact figure. In UK, the exact figure is 432 in 2023. Why the exact figure is not coming from NOTO when everything is computerized? It is a matter of a click to give us the figure that these many persons are waiting for organ, or they are dying, so many persons are dying. Why they are insisting for pledging the organs? Tell me one thing, as Rotary Namnath Pradeep has said, everybody is saying, everybody knows, pledging of organ is nothing. And I can also collect 1 crore of pledge forms, but what is the use? They are not going to donate because their family members said consent is to be taken. Instead, the NOTO, ROTO or SOTO are emphasizing on pledging. The emphasis should be how to create more infrastructure, how to ease. We are talking of business ease. Why not we have a medical ease? Change the law in the central government. All the state government should come, especially under the organ transplant. Like I will tell you, this Ayushman Bharat, the scheme is 5 lakhs rupees. But only for organ transplant, the scheme has been changed to 15 lakhs of rupees. I must not take the credit, but yes, it has happened in our program, my program only, with a media conference with Lal Goyal, when the present West Bengal governor was present, Dr. C.V. Anand Bose, and he took, told him very, very categorically, 5 lakhs is nothing. And you also know the private hospitals are charging in Mumbai 7 to 10 lakhs of rupees for kidney transplant. So forget about liver and heart transplant. And he asked me how much. I said 25 lakhs. But he said, you send me the recording. We sent the recording. It has gone to he sent to the Honorable Prime Minister. And I am very thankful to Honorable Prime Minister that he has increased from 5 lakhs to 15 lakhs. But here is a caveat. NOTO, ROTO or SOTO are not either aware or they are not interested to propagate it, to publicize it for the BPL persons. Why it is so? Is there any state government restriction that please don't do it? Otherwise, whomsoever I am meeting, they are not aware about this 50 lakhs. What do you say about this, Dr. Dixit?
Okay, so this point also was discussed during Chintan Shivar. You were also there. So we are putting that also on record, right, sir? So we will
Okay.
propagate this also. Okay.
Any other question, please? Professor Saran.
Thank you, Dr. Dixit. With your rich experience, you have given us a very good presentation today. There are burning issues, as you mentioned. What I would like to know is, with your rich experience, which two issues, if addressed, you think the gap between demand for organs and supply of organs in India will be mitigated, will be reduced, will not be as serious as today?
As I said, the first and foremost that we must have as many as retrieval centers, maximum number of retrieval centers, and that too in the government setup, because in the government setup most of the MLC cases goes with the suspected BSD or with the, so retrieval centers at all the medical colleges and district level, so that the supply starts, retrieval is there. And second is the other measures which we have already discussed, that regarding the consent and other things, because sometimes it is very difficult to get consent from the relatives after that. But if they have opted for organ donation, then it should be honored. So these are the two things which we should go with.
Oh, okay. Thank you very much. Rotarian Deepan Shah, please. Rotarian
Yes,
Deepan from USA right now. He stays there. He's a tissue retrieval expert, and although he belongs to Gujarat, but he's permanent citizen of USA. Yes, Rotarian Deepan Shah.
Yes, thank you, Mr. President, and Mr. Dixit, Dr. Dixit, was a wonderful presentation. I was listening, a lot of great questions came across this platform. So the reason my raise hand, the system I'm just, comparing, especially India is doing fantastic, going to be third major economy, but we are everybody, government, and we all media talking about just money, 5 million, 10 million, trillion. But every body, every organ is matters $1 trillion. So here, the main purpose in America, India is we are struggling with Ayushman Bharat, 5 lakh, 50 lakh, whatever. Here system is very crystal clear. If one doesn't have a insurance or medical coverage, and if he's on the waiting list, and if everything is matching, and when his turn comes, hospital don't look for any insurance or anything right there moment. They provide all these services, all this transplantation done, after pre and post care done very well, and everything taken care by the government or local hospital at state level also. Here the system is organized by UNOS, National Organ Sharing Network, and Organ Procurement Transplant Center, OTPN. They handles very thoroughly well throughout one uniform policy throughout the within a 50 state of America. So the biggest challenge what I see in India, and every trip I see, that biggest challenge is everyone looking for money. Even big hospitals, their priorities, what's their patient's financial status, how they could put up the money. So those systems, until we don't remove or eliminate those barriers, until then India not going to progress. Doesn't matter it is $1 trillion or $30 trillion. Thank you so much.
Thank you, Rotarian Deepan Shah. Yes, you rightly said, and it is in UK also. NHS takes care, but in India, this is the biggest problem, challenge. Yes, Mr. Martin would like to ask any question, Mr. Martin? Yes, please unmute yourself. Rotarian Martin. Please unmute Rotarian Martin.
Thank you, Doctor. I am very much happy with the presentation. No questions, Dr. President.
Okay. Thank you very much. Anyone else wants to ask question or Doctor? So otherwise, yes. Rotarian Ramnath Pradeep, still you want to ask?
Sir, I want to make some suggestion to Dr. Dixit. Sir, when there is a retrieval center is there, you got a guidelines that this is a minimum requirement. If when there is a college is established, there is a permission to operate the college. There is already minimum requirement is already fulfilled. If we identify ourselves as a SOTO level, if we identification is that even the private colleges, that they are eligible, what is the minimum criteria, and we give the deemed permission subject to compliance. What happens is, if you put the condition prior to that, this should be there, 1, 2, 3 things prior to applying. What happens? There is an investment, there is an investment involved in there. But if you give the deemed permission, that yes, we are giving you the permission provided you comply with it. The final permission can come at the later date when the operation starts.
What do you say about
When
this?
everything is ready. So what happens is, the investment is, somebody is making investment, he knows that I got already in principle permission, I have to comply with it, I have to make the investment. Then he is sure my investment is not going to waste.
Dr. Dikshit, what do you say about this?
Basically, this is what NMC was also doing when we go for the giving the letter of permission to the colleges. We do the inspection and we give a conditional permission. That's what sir is saying. So at appropriate platform, we can put this matter, sir. This is a good suggestion. Good suggestion. Good suggestion.
Sir,
Because
it will encourage the colleges and encourage the medical some of the hospitals who will otherwise will have minimum requirement, but they will encourage to go for the investment.
Exactly, and as I said, that for retrieval purpose, we just only need a OT, right?
Correct.
So this point is
I think all the hospitals
quite
in
well
India,
taken, at least at medical colleges level, because nowadays we have got a lot of medical colleges in the states. So
Correct.
retrieval center permission we can plan and discuss.
Yeah.
And then they will start investing, and they are sure that we will get the permission.
Okay.
Okay, thank you very much.
Right.
Yes, Rotarian Dr. Monis wants to ask one more
Yes,
question.
sir.
Yes, please.
So just one suggestion. So based on awareness, because so we know, like in medical colleges, even for the undergraduate or the postgraduate, there is no chapter or there is nothing talking about organ donation or organ transplantation. So what has happened, sir? I think just a month back, Indian Society of Organ Transplantation has had a meeting with the NMC chief and the DNB chief, suggesting whether a chapter can be introduced in the postgraduate studies or something be encouraged. So because awareness levels, even for the doctors, it comes only after a postgraduate level once they start the practice and once they start going for the specialization. So even if you talk about a doctor who's in family medicine, it's a big question mark. When we talk about awareness, so we talk about the non-medicos and medicos, right? So non-medicos don't have, medicos don't even talk about it. We are not taught in our schools. So this is something that I think NATO can take like a promise stand and probably talk to NMC about it, sir, very formidably.
Just want to share with you
Sir.
that for undergraduate in subject of community medicine, organ donation is already included for UG.
Okay, that
is already included. And for PG also, we can suggest to write to NMC to have some portion on organ donation.
Yes.
Right. For UG, they have already included.
But Dr. Dikshit, why only medical colleges? Why not it is from the
university?
No, not university. I just had a meeting with the president of NHAI, which is a body which is controlling about 1 lakh schools with 2 crores of the students. And I discussed with him, I said, after 5th standard, why not there is a one page at least talking about organ donation. The advantage is that once the child who will come to the home after reading that chapter or in the school, he or she is going to talk with the parents. So we basically that parents are nowadays dedicated to the children to teach. And when they are teaching, they will also become aware. So instead of spending so much money and efforts, if we will start from the 5th standard and in all the classes, increasing the more information, starting with a small information, increasing and goes up to the PG or UG or PhD level. Why not we start from the school level, so that the children will come to know when they will become 18 years or even earlier. They are the deciding factor today to take the decisions of their parents' organs to be donated or not, or some elders, the children used to take the decision. What do you say about this, Dr. Dikshit?
Yeah, I agree with you. Initially, we had because I'm a public health expert, so we had this child-to-child program, where the basis of this is what you were saying, that the child is the best person for advocacy to the house also. So NCRT people can be contacted for inclusion in this their syllabus, and at your level also you can do advocacy.
Okay, yes, because when I was giving lectures in schools, people used to criticize me. They says, you are talking to schools, they are not the donors. I said, they are the decision takers, they are the future of the country. If we will not change their mindset, they will not change the mindset.
They will discuss this with their parents, with their caring parents, and in children among themselves also. As I said, that in public health we have this child-to-child program with the same emphasis what you are saying. So that's a good suggestion.
Okay, thank you very much. I think we have very good interaction today. So over to you, Rotarian Pratul Agrawal.
Thank you, sir. Sir, I have some query. To check the unfair practices, we have put too many regulations, restrictions, and there should be a balance between the restrictions and regulations. And we should try to regulate also. So do you don't think we should relax some restrictions and expand the scope?
Like what restriction?
Because, now unfair practices are developing.
What like
Sri Lanka.
What relaxation you want? What relaxation you want?
Because with limited people may donate in case of need. Either very limited people can donate, close relatives only. And
yeah, अभी तो grandparents, grandchildren को भी include किया है. Then, as I said, we have an authorization committee, and I have started with my presentation that the act says that minor cannot donate. But as I said, that 17 years, 11 months, 15 days child, if that is presented as a case to the authorization committee, and then authorization committee gives permission for such cases, and then this will become as a unusual case for permission. So we have to do
Doctor, what his view is that instead of family, others can also give, like can give, and the authorization committee should give the permission.
Yeah, so that provision is already there.
But the problem which Delhi High Court has taken up in the one of the case last year was that it takes lots of time. And so they have given a suggestion. They have not passed any order. They suggested to the government and to NATO to make such type of timeline that within 3 months, either you should say no or you should say yes. But the thing is, whether we are definitely do it or not, and reply to Rotarian Pratul Agrawal, India is such a place. I am getting call. I'm sure Dr. Dikshit might be getting so many calls. I am getting every week 1 or 2 calls where they are requesting me and they are offering me 1 crore rupees, 50 lakhs to 1 crore rupees. I'm putting on the record, and it's a live telecast, to organize kidney or liver. Now, this is the situation. How the government can give such type of relaxation, and then people will definitely take advantage of it. Although it has already been taken, if you want, you can read the 3rd January 2023 Guardian article, or 3rd December, 6th December Indian Express article, where it was mentioned that Myanmar patients came to India. I will not name the institution. It is written very, very clearly in that 1,200 patients in 1 year, charged 25 lakhs to 50 lakhs rupees in Delhi. One of the most prime hospital of Delhi has done this. So I think government has to be more strict to see that such type of hospital should not do such type of butchery in India, at least.
Yes, agreed.
Okay. So over to you, Rotarian Pratul.
Thank you, sir. And now I request Rotarian Ramnath Pradeep, sir, to give the vote of thanks.
Please unmute. Pradeep ji, please unmute.
I am really honored and privileged to have offer a vote of thanks to such a luminaries, Dr. like Dikshit, who has really done a lot of things in Madhya Pradesh. That is what we have been hearing and we have been observing. And during his presentation, he has made a lot of things and accepted some of the suggestions, which probably he may take up at appropriate level, because he is the one who has a guts to take up the matter, because I have seen him even when last time when we met him, and he has taken certain issues which probably will go a long way to ease particularly on the organ donation side. So it is a great pleasure, sir. We all benefited with your presentation, and we
Thank
find
you.
that with our suggestions, probably you will also take up the issue with the appropriate authorities. And as and when there is a need for Rotary Club of organ donation, we are there to support your action or your efforts wherever you need us. Thank you, sir. Thank you once
Okay.
again for your time and
Thank
efforts
you
which
very
you are
much.
making. It's a great pleasure having with you here today. Thank you, sir.